It is time to visit some of the most common problems people face when changing their diets and nutrition. If you are like most people, you will run into some problems. And it is totally normal. It isn't always about smooth transformation, it is about testing, learning and improving. That's how everything works in the universe, and don't take seriously all the marketing hype and Yellow Pages transformation stories. They are showing the 1% good and leaving out the 99% ugly. Let's visit the problems one by one. First off, fatigue. It is a very common side effect when transferring to a new diet. You might feel worn out, sluggish, not motivated to do anything, even your sleep might be affected. There are two most common causes for this that are easily fixable. Usually it is either dropping your calories or your carbohydrates too low or too fast. When people start the transformation process, they are very motivated to get the results as soon as possible. This often leads to dropping calories and carbs too low, which causes the cells of muscles and nervous system to suffer from energy deficiency. This itself causes the release of stress hormones, mainly cortisol, that causes its own side effects. This is something that usually starts in the first week of changing the diet, and is quite easy to recognize. What to do? First of all, you should increase your carb intake, also protein and fat, if needed, by 10 to 20 grams a day, or overall calories 50 to 100 kilocalories a day, until you feel good again. After that, you can experiment more freely with your macronutrient composition. Second, intestinal problems. Those are very common when starting a new diet, and especially nowadays, when our guts are in a bad shape to start with. The common intestinal symptoms when starting a new diet are bloating, diarrhea or constipation, or both intermittently, gas pains, heartburn and reflux, and even loss of appetite. One way to treat this problem is to give it time. Fast and large changes in diet causes hormonal changes in the intestine and at the intestinal microbiota at the same time. But this is the adaptation to new and is quite normal. Our intestine and hormonal system is quite effective, and it usually takes 1 to 4 weeks to adapt to the new diet. So, when your symptoms aren't that bad or don't disturb your day-to-day life too much, giving it some time might be the best way to go. The second problem that we went over in the fiber video is too much fiber too fast. This can cause all of the above symptoms. The cure is simple. Drop the fiber amount, or just eat the fiber that you know that your intestine can handle. Usually oat has the kind of fiber that is friendlier to the intestine. Should you use fiber supplements like psyllium? In some cases it is totally fine to use fiber supplementation, although there is rarely a reason to when you are eating correctly. It is recommended to use psyllium or other fiber supplements when you can't get enough fiber from your diet for some reason, or you have special medical reasons too. Psyllium may also be a good fiber to test out when you have an irritable bowel syndrome or constipation. Just remember that you have to drink more when you use fiber supplements. And also that fiber supplementation can affect drug absorption, so be aware when taking any prescription drugs. Of course, you might have irritable bowel syndrome or IBS, which is a very common problem nowadays. If nothing helps, it is recommended that you'd seek out medical help. In some cases, there are intestinal symptoms caused by supplementation, especially when one starts many at the same time. In those cases, it is recommended that you'd stop all supplementation, and start them again one by one slowly. Dehydration. Especially when dropping weight fast, changing eating habits and being more physically active, getting dehydrated might be an issue. You might get headaches, dizziness, fatigue, even palpitation and weakness in your muscles. We covered it mostly on the hydration chapter, but there is more to it. It isn't only about how much water you consume, but how much you can keep in your cells, tissue and bloodstream. We won't go deeper into the physiology of this, but basically it has to do with mineral levels in your body. That's why it is also important to have good mineral supply in your diet. You should definitely check out mineral supplementation options if you are physically very active, sweat much or feel overly fatigued or dizzy. Acutely lowered blood sugar and blood pressure. That is actually a very good thing, but may cause problems for people with blood pressure or diabetes medication. This is why it is important to monitor both of those more intensely in the beginning of your transformation process, and have some kind of plan to lower the medication. Always consult your healthcare professional in those cases, and preferably before problems arise. There you have the 3 to 4 most common problems when starting a new diet and lifestyle change. If the above advice doesn't work, or if you have medical conditions, it is recommended that you go see your doctor and maybe have some tests done. And don't worry too much about the problems when you run into those. This is totally normal part of any change. The worst thing you might do, and people very often do, is to start looking for the next trendy diet with the first signs of challenges. Let's do it differently this time, stick to the plan and come out of it so much stronger.